Okay, let's have a conversation about a skill that I like to use in the clinic that's pretty basic to do, but it's so handy, which is basically trying to get pain to go away, right there while the patient's on the table. The most common one that I use is for menstrual cramps. Okay, so you have a patient coming in with any kind of menstrual cramps in any part of the cycle, doesn't matter. And what you'll do then is palpate a couple of points. And if you find tender points, you're going to needle them. And then the idea is that when you needle them, then the pain should go down right there on the table. So let me describe this. So patient comes in, menstrual cramps, lay them down, and then I'll palpate a few points. Usually I'll start with, well, here's my mix of points, and then you can kind of just palpate them all and see, which ones are tender. So liver 5, common one. Spleen 6, liver 4, spleen 4. So these would be pretty typical common ones to try. You can get into the gallbladder points like gallbladder 41, 42 might be quite tender, in which case you can needle them. In a sense, it doesn't matter. The question is which ones are tender. So you might touch them all and see which one is the most tender, and it can be sided. So liver 5 on one side is quite tender, and then liver side on the other side, no big deal. Well, then use the side that's more tender. Then what you'll do is the patient's laying down, and just have them breathe. Just have them relax, have them close their eyes, and just pay attention to how the cramping feels. Okay? So they're going to need to be feeling the cramping while they're laying down. And then what you do is you're going to take a needle, preferably I hate to say it, but preferably one of the bigger needles, just like something more like a Chinese needle, or a carbo or something like that, because sedation, at least from a Chinese needling perspective, sedation requires stronger sensation. Right? So the stronger the sensation is, the more sedating a technique is going to tend to be. The lighter a sensation is, the more supplementing that is going to be. So from a strictly Chinese needling standpoint, and this is very much a generalization, what you're going to do is you're going to needle that point in a sedating manner, here. So what are you going to do? So typical ways to do this is you position the needle against the flow of the channel. You use a thicker needle because that'll produce more stimulation. One way to sedate a point, for example, is to twirl the needle, and this is typically said in a counterclockwise position, although we can talk about that. And then what you do, though, is to sedate, then you count in rounds of 6s. So as you're sort of pulling the needle back, kind of twirling the needle, you say 1, 2, 3, 4, 5, and 6, and then you just start over. And in doing it in 6s is said to be a sedating technique. Okay. More to the point here is what I'm going to do is I'm going to needle the point, and then I'm going to manipulate the needle, whether you do it in a sedating fashion or you're just manipulating the needle to obtain the de qi sensation. And when it's a more general Chinese style, then you're sort of waiting for the patient to respond. So what I do is I say, okay, I'm going to needle this spot, and then I'm going to kind of twirl the needle. I'm going to move the needle a little bit, and I want you to tell me when you can feel the needle. So then I'm manipulating the needle, and then when they feel something, then I say, okay, how do you feel? How does the cramping feel right now? And they kind of pay attention. And if you got it right, they'll say something like, yeah, I guess it does feel a little better. And then you say, okay, so maybe you want to put a metric on that. You say, well, how much better does it feel? Like 10% better, 50%? Just to kind of get them aligned with it so that they're paying attention. Then you do it again, same spot. If the spot worked the first time, then in theory, the spot can work until you get that pain down to as close to 0 as possible. Okay? So then I go again. Manipulate the needle, stimulate the point. They say, okay, I feel that one. Okay, now how do you feel? And we can just do this again and again and again. As long as they're continuing to improve, then you can keep doing that. If they start to plateau where they're saying, it feels the same multiple times in a row, go find another point, maybe the same point on the other side. If that's not very sensitive, go for the most sensitive, the next most sensitive point. The points that I gave you guys, it's not that those points are so important. Any point can work here. Whatever point that you have that you like for blood stagnation, chi stagnation in the uterus, by all means, the palpation is what will tell you if the point is useful or not, right? So this, for those of you who are familiar with the master tongue system, this is very much like this. So if you want to use master tongue points, of course, this is normal, right? So this is just a standard acupuncture technique. You know, from many, many different systems will teach some variation of this or some very exact kind of thing like this. When you're doing the menstrual cramps, of course, you're trying to get it so that the pain is as close to zero as possible, okay? The pain may move around. And so if they start getting real specific, like, oh, the pain is right here in this spot, then you might look, okay, what channel is going through that area, and start testing a few points further down on the feet in that channel, right? Again, the point itself is not that important. Remember, in a sense, points are just guideposts for needling. You know, there's any number of reasons why we might use a point, but ultimately the use of that point, at least in this situation, is dependent upon palpation. The stagnation that the patient is experiencing in their uterus is being reflected on the channel. In later, maybe in the next round here, we'll talk about a little bit more how the internal organs relate to the channels. But for now, this is meant to be just sort of a practical setup here. So the patient is laying down. The key is to get them pay attention to exactly how it feels, their pain, their discomfort. Then you start needling. Then ask them to tell you, how does it feel? Or to ask them to tell you when they feel the needle sensation. When they do, then you ask them, okay, how does it feel now? And in a way, what you're kind of doing is aligning their shen. You're getting them aligned with the idea that the pain is going to go down, right? So what in Western medicine we call kind of, in a sense, placebo effect. And in Chinese medicine, we call it some variation of alignment of the shen, right? Because the shen is so yang and it moves so much that when the shen is moving, it can move through these obstructions. Right, so alignment of the shen, and there are a million examples of this that are possible here. Just like headaches, for example. So somebody comes in with a headache, and you always ask, well, where is it located? Frontal, temporal, occipital. Well, if it's frontal, then you can ask. Well, you can palpate points. Stomach 44, stomach 43. You know, there's sort of modified stomach 44, which is on the next joint over. You know, sort of on the next, you skip over a toe there and it's on the other side. Look for tender points along there. You know, if I'm at stomach 44, I'll check 43. I'll just sort of touch all the points there, sort of from stomach 44 and then proximal, going up the foot just, you know, about an inch or so, just to see if there's any tender points there. If you find one, then you can needle that, right? Maybe you need to needle the spleen. Maybe there's some points along the spleen that might do that, because the spleen and stomach are related to each other. The number of points that are possible here, of course, starts to skyrocket, you know, because there's any number of connections between different channels. You know, maybe the large intestine channel might work here, or the heart channel might work here for, you know, so different ones, different reasons. And maybe in another time, we'll go through all the different connections. But right now, we just want to keep it simple, okay? A good example of this is like neck pain. So somebody comes in with a kink in their neck. Well, the most common channel that I see used for this kind of thing with neck pain tends to be the lungs, the lung channel specifically. And usually where I'll start is palpating something like lung 6, right? So it makes sense. She cleft point, pain along the channel, this kind of thing. And then I'll palpate basically along the lung channel of the forearm, you know, starting somewhere, you know, just below lung 5, going through lung 6, and even testing things like lung 7. Somewhere along that line will be tender points. then the game is the same. What you want to do in this case is you want to gauge pain levels and you want to gauge rotation. How far can they rotate? Because sometimes you need a little bit more of an objective measure, because sometimes the patient will just say, well, it still hurts. But then you're like, but you're turning 40% more than you were. They'll be like, oh, I suppose that's true. So, but the same process applies. Have them go into rotation, find the point where they hit pain, pay attention to that point, needle the lung channel, wait till they get sensation, and then have them turn it again. If you're a more strictly Japanese style needler, then rather than having the patient feel the chi sensation, you, of course, will be the one experiencing the chi sensation. So if you have some experience with this and this is your preference per practice, then you sort of look internally and you see if you feel that sensation. And when you feel the chi arrive, then you ask the patient, okay, now rotate, right? And lots of practitioners, they don't even have to use needles for this. You can use contact needling or a teishin or some kind of connection point. But suffice it to say that this is the more typical Chinese thing would be to use, because you're trying to sedate a stagnation. You're trying to break through a stagnation. So sedation techniques prevail here. So a little stronger stimulus than would typically be normal. Okay. So give that a try. Let me know if that's working for you. All right, you guys, take it easy.